Hey, hey, hey. Oh my gosh. Hey, Carl. How are you?
Good. How are you doing?
Good, good. Thank you, thank you, thank you. So Serette, you're going to be the master of ceremonies. So,
After you do your introduction.
you say what?
After you do your introduction.
I'm gonna get to it. I'm gonna get to it. So it's gonna be a very informal introduction. So again, what I was saying earlier, Serette, we connected a couple years ago when you guys were part of the block party through Howard Brown, and we just spoke about the wonderful work that you're doing and the importance of doing this in the Black community. And and you were very intentional about making it happen. So I'm like, man, whatever you need, let's just work together. So we started this series of of programming, and this is one of those things that I thought was very important. Talking about the vaccine, especially in the last couple months, being in the store a little bit, and that's been a topic that's come up a lot, and folks are kind of hesitant about it. To be honest with you. And for me, it wasn't about trying to sell someone on getting the vaccine. Either it wasn't about that. It was about let's just find some experts who can put out some proper information. We can answer some questions from people who we actually trust. And so thank you everybody for joining this panel. And we got a couple questions already, but I want you guys to speak, about who you are and what you do, and we'll do some questions and answers and just get the word out to everybody. So, Serette, you can take it from here.
Hey everyone, my name is Serette King. I am the Director of Community Engagement and Relations at Howard Brown Health. But I do want to take a step back and acknowledge the space that Eric Williams created with the Silver Moon Block Party. I am not a native to Chicago, and when I was crossing the street, I had never seen so many beautiful Black people gathered in one space in Chicago. I live in the North Side and I've lived on the West Side, and you don't get that feeling either place, right? And so when I saw it, I had to go home and change because, of course, I didn't think I looked cute enough. But when I got cute, I came back down, and it was one of the most amazing experiences that I've ever had in Chicago. And it was imperative that I felt that Howard Brown be a part of this beauty that is the Silver Moon Block Party, so that we can allow community to really have the amazing care that they deserve, right? Care at Howard Brown, care at Rush, care at Christian Family Services. So thank you, Eric, for creating that space. Thank you for constantly creating a space for Black and Brown and people of color to be able to gather, to be able to enjoy, to be able to get the resources that they need. So with that being said, thank you everyone for joining. I am here with some amazing physicians. We have Dr. Lisa Green. We have the amazing India Willis, nurse practitioner at Howard Brown in 55th. And we have the amazing Carl Lambert, who's a physician family practice with Rush Medical. So I'm gonna pass it off to you, Lisa, to introduce yourself, and here you go.
Oh, good evening. Thank you so much. My name is Dr. Lisa Green, and I am the CEO and co-founder of Family Christian Health Center, and just honored and happy to get the word out. So applause, to you guys for really allowing us this space to be able to ensure that our communities get facts to replace some of the fear and misconceptions that's going rampant in our community. So thank you for having me.
Thank you, thank you. Can you popcorn it off to someone else?
Yeah, and I'm going to popcorn it off to India.
Okay. Good evening, everyone. My name is India Willis. I am a family nurse practitioner and HIV specialist for Howard Brown Health. Howard Brown is a federally qualified health center. They have 12 locations throughout the city of Chicago. Some are in Inglewood, Back of the Yards, Humboldt Park, but I work in Hyde Park on the South Side. And like Dr. Green said, I'm just happy to have this opportunity to talk to our community and just get rid of some of those misconceptions and answer any questions and address any hesitations. So thank you, Silver Room, for having us this evening. And Dr. Lambert?
Yeah, hey. Good evening, everyone. My name is Dr. Carl Lambert. I'm a family physician by trade. So I work at Rush Medical Center as an assistant professor of family medicine there. But I spend a lot of my time providing primary care, a lot of times for Black and Brown populations. So happy to be here in this space to just share really a mixture of compassion and then also competence, and to educate wherever we can and to dispel misinformation and just to answer questions and just be a safe space.
Well, again, thank you so much for joining us. And so we're going to give this time for community to be able to ask the questions they need. But of course, we want to get a couple of things out the way real quick, because we know you've heard it before. We've been talking about it for the last 8 months. So what is the COVID vaccine?
Right. So the COVID vaccine is our opportunity to build up our immune systems to be able to fight off the SARS virus known as COVID-19. The vaccine, people think it was a lot of new technology, but in fact, there's been a lot of technology. This isn't necessarily new. And so what you have available right now are 3 vaccines, right? The vaccine, the Moderna, there's the Pfizer, and then there is the Johnson & Johnson. Now, the Moderna and the Pfizer vaccine have what we call messenger RNA. And so, but what does that mean? It just means that the body takes what we call the spike protein. It takes a snapshot of what the virus looks like. And then your body sees that picture and says, oh, I don't like this. So we need to break this down. When I see this, time to go, time to fight. I need to pull my army together because this is not a cool place for me to be, right? And the Johnson & Johnson does the same thing, but it just goes a different mechanism. It doesn't take that particular snapshot. It has another way, and it's very similar to the flu vaccine. And what happens is your body has an image or picture of it, and it says, oh, when you see this, body, I need you to fight it and get rid of it. And that's really the big difference between the 3. Now, but what happens is the Moderna and the Pfizer both are 2 doses, right? You get 1 shot the first time, and then within 30 days is when you get a second shot. The Johnson & Johnson is just a 1 shot just because of the way that it drives. It's no different than almost you have a car on expressway. Some people drive an SUV, some people drive, they may drive a Prius, right? It's just they get to the same destination, they just ride in a different vehicle. And that's what happens between the 2, right? The issue though, is that after you get the vaccine, you have to make sure after first vaccine number 1, that there's a 30-day window after that, and then you get the second shot, right? As opposed to, again, with the Johnson & Johnson, there's only 1 shot. And that is the biggest difference. I think the other piece that we've been talking about is the fact that the research and people that are at the helm of some of this research for the first time in a long time, they look like us, they talk like us, and they made sure that we were involved. And so that's given us an opportunity at every level, right, to realize that there are people that are looking at this to make sure that what was done was fair, that was right, that it was just. I mean, we know by history what's happened before. So I think we have to really realize, as these vaccines were being developed, the people who are sitting in those spots, it wasn't a paycheck, right? That wasn't the driver for them. It wasn't getting the notoriety. It was coming from a place that we have not always done good by our Black and brown communities. So we need to make sure, if I'm sitting on this panel, I need to make sure that what we're looking at is a representation of us. So when you look at the studies between Moderna and Pfizer, they had roughly around 10% of African Americans participate in the study, whereas Johnson & Johnson had an even higher rate of that. Now, while that number sounds low, considering most studies we barely get people to participate, that's actually a large number of people that took the time and that were involved in the studies to make sure that the information and the facts and the follow-up and the body dynamics and everything were representative of the vaccine, so to ensure that each patient population was going to have a representation of what the final version was going to look like.
Thank you so very much. I like that. We're, it's riding on the same highway. We're all going to get to the same destination, but we might be driving in different vehicles. Love it, love it, love it. You touched on it briefly, and this is something I get all the time. Oh, well, if vaccine was there, why it took so long for them to get out? Could you tell them just a snapshot of how long that this vaccine has been in the works, in the actual medical history of that?
So some of the messenger RNA, that research had been actually since the 90s, right? Since the late 90s is when we realized that this technology that was going to, who knew back then that it was really going to be propelled right now, right? And so that's been at least, 20, 25 years plus for the technology that's there. When it comes to the newer vaccine, that's when we talk about the Moderna and the Pfizer. When you talk about the Johnson & Johnson, flu shots have been around a long time. Not that all of our communities sign up and say, let me get a flu shot, but the mechanism for getting them has been there for the longest. Also, just vaccines, period. Years ago, people died from polio. They died from measles, mumps, rubella. Think about it. Chickenpox was, a virus that we had for years, but then we realized that, wait a minute, we needed a vaccine. Then we had to come back and say, well, not instead of one shot, we need to have 2 shots. So vaccines as a way of allowing the body a chance to really be able to fight and build its army is not a new concept. Not a new concept at all. And especially when something is a virus as opposed to a bacteria, we have to have our own immune systems in a positioned way to be able to create what we call that response for that army. I tell people it's just like if you play in the NBA, you're watching the NBA, they don't just show up, right? They have to prepare. There's practice and things like that. So when you get the vaccine, your body is then getting a snapshot again to say, hey, wait a minute, this is not good for me. And so therefore, when you see this, I need you to have all of this prepared because when they come, I need you to get rid of it. And that's what it does.
Can somebody tell me, and I get this all the time, well, why I gotta wait 30 days? I ain't got time for waiting 30 days. I'm on vacation in a week. I'm getting ready to go visit my family and we getting ready to have a cookout. I need to get this now. Why?
Dr. Lambert, you wanna?
Yeah, I mean, there's a lot of things that kind of came to mind with what Dr. Green said. I couldn't agree more. When you talk about, immunology, this is like immunology 101. So vaccines are really the way to go. And it makes sense. If you can in any way bypass actually getting COVID-19 yourself, that really is the way to go. Because, it's a mixed bag as far as what can happen to patients. We don't know if that will lead to hospitalization and intubation or even death. Or even if you're a younger patient, I have a younger patient that say, hey, Dr. Lambert, I'm fine. But we're even seeing patients that have a myriad of symptoms that we don't even fully understand yet called the long hauler symptoms. So where they have fatigue, memory loss, cognitive sort of decline, a lot of just vague symptoms that are still debilitating in some way and messes with your quality of life. So vaccines really help you to get the antibody protection without actually having to suffer the disease or whatever that outcome tends to be for people. So that was the first thing. And then what was your question, Serette? I forgot the question.
In between my first and my second shot. I got places to go, people to see. I need this done now.
Yeah, so it's kind of like revving up a car almost. So like I like using metaphors when you talk to patients. So to mount a full immune response, your body needs time to do that. So really that second shot's almost like a booster shot where you get that full, more robust antibody response that really lasts. So one thing that patients will say is, hey, Dr. Lambert, I had COVID. They'll say full transparency, I had a cold or lost taste and smell for a little bit. I'm good. But what we know is with vaccines, they tend to confer longer protection periods. So patients who maybe even had COVID-19, their immunity may last about maybe 90 days or so. It varies, but 90 days or so. But with vaccines, it tends to be longer, right? If you look at vaccines in the past, like what Dr. Green mentioned, some of these you get once every 10 years. The jury's still out with COVID-19 and the different sorts of vaccines that are out. But the hope is that it's maybe a year. It may be a seasonal sort of shot. So again, it lasts longer than if you were to actually have to get the infection itself. And probably that's because when you are infected, your body's weaker. Your body's doing a lot of things to try to protect yourself. So it's really hard to mount that really full response as opposed to you're presumably healthy when you go get these vaccines. So that's really the methodology as far as separating the dates. So hold off on cookouts or other things. And even if you get that second vaccine, there is that two-week window. And then even still, you should continue like universal precautions. So masking, washing your hands, all these other things that have become pretty commonplace for us now.
And I tell people, that wait of 30 days, if you think about it, the body still has to take care of if you get cut and it's got to heal itself. If you order some Grubhub or something that didn't agree with you, your body still has to show up. And so you all day, people are on a Zoom call or here or there. All those other things are still going on in life. And so the immune system has to be ready to fight. Well, it needs a minute to be able to, okay, you got this picture, I need to make this, but I still got to be on guard because of all of these other things. And it is at night when we actually get our rest, when the body can actually build, because other than that, we are reading, looking, moving, exercising, again, trying to do a Zoom or trying not to do a Zoom for that matter. It's all of those things that are happening to the body. So it needs a minute to build up and to know for sure, again, that the army is ready. I got on my belt, I got on helmet, I got everything. So when this comes, you don't want to go out to war and, oh man, I forgot my holder. Oh man, I forgot my gun. Or man, I forgot. So the body needs a minute to arm itself completely. That way it knows that it's ready.
Thank you. First of all, I love the rev up 1 to 60, 60 to 100. So if you didn't get to 100, that means you're not supposed to be going to a barbecue. You're not supposed to be going to a friend's house who's having a little house party with 30 other people. That means wait until your full dose, first and second. And, it's sad to say, we should have been washing our hands a long time ago. My mama used to say, did you wash your hands every time I would go to eat, every time I went to go give her a hug? Because I came home from school, she don't want your germs. So we should have been washing our hands. This is common practice. Everybody wash your hands. And just because you get the vaccine doesn't mean that you stop wearing a mask. What I found that with wearing that mask, I got less colds. I got less issues with my allergies because I have severe allergies. So every time I turn around, there's something going on with my nose, something going on with my eyes. But what I did find is that I had better breathing with my asthma. I had better outcomes with not getting sick during the winter time. So, if it's been working, why stop it? Wear your mask, continue doing what we're doing now so that everybody is safe. So thank you so very much for, talking about the really the beginnings of what the vaccine is, and so that we can get that out the way. And so now that we've gotten that out the way, let's talk about a little bit of the things that really are facing communities. And that is the hesitancy around getting the vaccine. For many who are older, who've lived throughout polio, who lived throughout chickenpox, measles, all of these things that affect our body, why do I need to get this now? It ain't for me. They're using me as a guinea pig. Why should people trust in getting the vaccine? And why should we worry about a more global idea of saving people as opposed to just saving yourself?
Indy, you want to? Oh, I'm sorry. Go ahead.
No, it's was someone chiming in?
You know what? I will pass it to you.
The global health question. I think that's a really, really good question, Serette, and it comes up a lot, especially with my patients. I tend to see patients under the age of 30 who say, if I get COVID, I'll be fine. I had friends who had it, I'll recover. It's not a big deal. And I can't say that they're wrong. A lot of younger people are not affected the way that the older population is. That is just what we're seeing. It's not saying it's impossible that you won't have a negative outcome, but that's not what the media is promoting. So a lot of younger people don't understand the need for all of this hoopla or vaccines. But it's about taking care of each other as a community. We have to look out for one another, especially when you're going to your granny's house on Saturdays and you stay with your auntie and you drop your kids off. We all help each other to get through the next day. It's no different with this vaccine. It's not just protecting your body and building your immunity, it's protecting your community. So if your community is helping you in any aspect, whether you go to your local beauty supply store or wherever you're going, you don't know who you're exposing, who's vulnerable, what they're going through, what their background medical condition is. It's about what's doing the best for the greater good for our people. We always talk about other communities, how they look out for each other, how they help each other out, how they give each other jobs, whatever the case may be. We need to look out for each other medically as we would with anything else. So even if you feel like you're the strongest person ever, you never get colds, you don't get sick, that is wonderful and a blessing, but everyone is not that lucky. And it's about what's doing best for the community. So when I got my vaccine, I will admit, I had COVID. I was like, do I really need it? I had everything Dr. Lambert said. I was that patient. It's like, I don't know. But then here I am talking to my patients, breathing on them, being around them, and they're coming to me thinking they're safe. It's irresponsible of me to talk to them, to be around them, to pick my children up from the babysitter, to do the things I do every day in my life, knowing that I could possibly be spreading an infection. So I did my part to keep my little bubble safe. And if everyone did that, we'd protect each other as a community, which we should do in every aspect, but especially in healthcare. We're really missing it with healthcare. So that's why I think it's important.
Come on, and you wrap that up, but I think we do have some more comments. Lisa, Carl?
I mean, I love that. I absolutely love that. I think if there's anything we've learned over the last year is that it has to be a communal mindset that we will get out of this together, right? And then also when I think about like health equity and the statistics that who are the populations that are more likely to be hospitalized or die from COVID, Black people are 2 to 3 more times likely to be hospitalized or die. This is an opportunity to improve those statistics. So I don't want this to be a moment where we miss it and that worsens the statistics. So when you think about Tuskegee, that was a study where something was supposedly given, but it never was. Whereas this is the flip side. This is a vaccine that, as Dr. Green mentioned, we were involved in the planning and even in the studies behind it. We were included, we were thought of, we were not left behind, and we're being offered something as an act of really good faith. So those are just some of the remarks I was thinking about as she was speaking.
And I think about, we hear the word herd immunity. Well, what is herd immunity, right? So, and that means that, 70 to 80% of the population have either had COVID or they've had the vaccine. And so we hear these variants now and how the variants now are easier to get. So they're not stupid, right? While we're mounting up our army, trust me, they're mounting up their army. They wearing one mask, cool. Then guess what? They need 2 because I can go past the mask now. And so therefore, what happens is we will leave what I don't want to see. And we never tell people which direction to go, but let your decision be based on information that you've got, not just off of YouTube from somebody that has not gone to medical school, not from social media, we were just talking about with India, your cousin, sister, friend, nephew who had it. Get the information so that you can make the decision yourself, because no decision at some point will be a decision. Mm-hmm. Because what will happen is the variant will then, it has to go someplace. So where will it go? It will go to the people who haven't had it or the people who have not been vaccinated. And these are the same people that overnight their hypertension didn't change, their diabetes didn't change, the stress level, trying to Zoom with my kids and hold down my job, all of that stuff didn't change yet, right? And so therefore we have to be able to equip ourselves with enough knowledge that we make an informed choice about the vaccine, about the virus, because that's what viruses do. Right? It's an invisible enemy that we all fight, but they also learn. They're very smart. And as we're learning to do one thing, they're learning to go about it a different way. And so I think that's why it's so important for us to get that information for people to get the vaccine, to think about it even. And I will tell you, quite honest, so I do family practice, and Carl and I actually worked together before, and our practice is in the far southern suburbs of Chicago. We're in Harvey, but we have patients from, all over the place. And anyway, when the vaccine first came out, I was one of those that was like, nope, not enough information, everything else. And then when it came down to it, I had to call Jesus and everybody else because I wanted to know enough information, because I also knew the first thing that my patients are going to ask me was, did you get the shot?
You get it?
Right. And if I said no, but I offer it, what kind of confidence is that? And I will be very honest, when I first took the vaccine, I didn't just go sit like this. I was a nervous Nelly. I'm thinking about what could have happened here. What are sciences? Did they do this? Because the more information you have, sometimes it can make it worse. And then the anxiety that comes with that. That's a whole nother level of just getting that. But I think that now more of the providers have gotten it. They realize that we didn't grow, a third arm. They realize, some of the side effects and things that we look at are things that we can predict. Some with COVID, you can't.
Yes.
And so I think that as we, as a healthcare community, are still educating ourselves and the people that we work with and we love and we take care of, I think you are now getting a different level of comfort that people have to even, think about it. I used to ask patients sometimes, have you thought about the vaccine? Yeah, Dr. Green, thought about not getting it. And so that's it. Right. But when you ask them, but tell me why, and I'm okay with that. We never force anybody because you have to do what's best for you. Right. But the reason was where we fell off, because it was nothing that they had a conversation with someone about for the most part.
And just to, I want to say one thing about just to follow up with Dr. Green. I appreciate the Silver Room for having this conversation, because it's not you should get vaccinated and this is why we're telling you to get vaccinated. It is literally just a conversation with a bunch of people that went to school for a very long time and owe a lot of money, but we know some things about some things. And we also understand the hesitancy, the fear. We experienced it. We're not above it. As Dr. Green said, I was nervous. I was like, am I going to turn into a bat? I had all type of thoughts. But I had to do my research. I had to talk to my primary care provider, and I had to really pray about it. Everything Dr. Green said, I felt the same way. So we're not here to say what you should do. We just want to give you correct information from a reliable source that looks like you, and to say that you are heard and we understand the fear and the concern. And we will do our best to explain and answer. We may not have all the answers in an hour, but at least it came from somebody that gets like your hesitation and not just telling you need this vaccine and you should get it in the end. We're not speaking at you, we're speaking with you.
Yeah, because they have to realize all of us on this call, our cousins, sisters, friends, everybody called before we came up. Well, could you ask? Well, and so that was the information and that's a responsibility that we really had to dig into before because I wasn't gonna open my mouth and say a word. It took a minute. You didn't see any YouTubes from Dr. Green in the beginning until I got enough information. And I think the one thing that we have to realize too is when my first patient who got COVID the second time, I was like, Houston, we got a problem. I thought you could only get it once. And I didn't realize that. Well, we didn't realize that as a community and how devastating that is for people. So just because you've had COVID once does not mean you can't get it again. And when you get it again, it does not, you don't necessarily know how it's going to affect your body, no matter how old you are. And that was a big misconception for people. Oh, I had COVID already, I'm good.
Yes.
Sorry.
And one thing to say about that is the vaccines protect against severe illness. So when people say, is it 100% sure I can still get COVID with the vaccine? You can, but the likelihood of you ending up on a ventilator is probably nil with that vaccine. And the research that we've seen, they really protect against severe illness. So we can't say, yes, you may get COVID again, but the vaccine is what is going to protect you from ending up in the ICU. So that's what we're really talking about here: severe illness versus not having severe illness.
I want to say two things. Remember, it takes a village, everyone. So if you have never been a part of the village and you want to know how you can help, this is your moment to help. This is your moment to be a part of the village, to make sure that everybody is protected and safe. And again, like India and Dr. Green and Dr. Lambert have said, you can catch it again, but the severity of it is not going to put you in the hospital. It's not going to put you on a ventilator. It's not going to take up beds from people who have heart problems, who have severe asthmatic problems, who have severe diabetic problems. This is going to free up so that people can take care of the everyday problems that we also have to face, right? And then the next thing I want to just jump on is, remember, if you have a primary care physician, you have someone that you can talk to. You have someone that you can to relate to, because they are human too. But if you don't have primary care, you can't get that special care. So I implore you, please, if you don't have a primary care physician now, this is the time for you to get a primary care physician. This is the time for you to lean on your community health centers, federally qualified and lookalikes, because they are there to make sure that you are every day okay. Not a Band-Aid, not a once and done. This is someone that you can build a relationship that is going to lead you to better health overall. Carl, you had something you wanted to add?
No, I feel like everyone's kind of saying all the good stuff. I'll just share that yesterday, to your point, I had a African American guy, 32 years old, there for health maintenance. So, I tell my students all the time that you always do health maintenance no matter whenever they come in, and that includes vaccinations. So he came in, he said, Dr. Lambert, I already know I'm not going to take the vaccine. So what I did was I had a relationship with him, and he knows that I care about him. So I just kind of inquired, not a bringing shame, but really just a curiosity. Well, what's the hang up? So we were able to kind of unpack some of the things that he had heard. And a lot of it was misinformation about, well, the vaccine just came out 2 days ago, I'm not getting it. And we were able to dialogue about, well, that's not quite true, and this and that. And he went from a absolutely not to, I'll think about it. So that's just a microcosm of the power of primary care. So we do a lot of maintenance. We're looking out for you. We're trying to make sure problems don't become problems. So that's cancer screening, checking cholesterol, so on and so forth. But it also includes talking about vaccines like tonight.
And I think the thing to remember with fairly qualified health centers is that you can be uninsured, underinsured, or no insurance whatsoever. And the navigators that we have, because a lot of people lost their jobs and they got offered Cobra, they couldn't afford that. And so therefore, you still have a place with fairly qualified health centers where you can go. They're not hole-in-the-wall clinics, where you really have professional, caring people that love what they do. And they are really and not to direct you, to force you to do anything, but really work at helping you become an informed navigator of your own health. And this is an opportunity now for people to really look at what wellness looks like, because that's what really put us at risk, because so much of that has been deferred, over the years. And a lot of times people will say, well, this happened to the person and they died, or this happened. Well, honestly, you really don't know their whole full snapshot of what was going on, right? You don't know that. And so without us knowing the ins and out of what individual person has, it's really hard to generalize a conception of what is. And so that's why it's so important, for forums like this, for people to ask questions and, hear from doctors who were scared to get the vaccine. But anyway.
Thank you. So I'm 72 years old, not me, but one of the questions that was posed, right? I'm 72 years old and I've never had the flu or cold. I'm afraid the vaccine will mess with my immunity. Will it mess with my immunity? Should I be worried? What should I be?
I can take a crack at it. So no, it shouldn't mess with your immunity. I would say I would change mess to enhance. It should enhance your immunity to COVID-19. And when I think about flu and colds compared to COVID, COVID is way more severe, hence the name. It's a severe acute respiratory distress syndrome. It's way more contagious, tends to have poorer outcomes as opposed to a flu or a cold, where a lot of times conservative measures can be used. So it's kind of a different ball game there. And then also the age of 72 is important to make note. So when we think of high risk populations, I think we know that a lot of the earlier phases for the vaccine rollout included people over the age of 65. So being over the age of 65 is a risk in and of itself, where you theoretically could be in that camp where if you were to get COVID, it could lead to poor outcomes. So again, the vaccine should not mess with your immune system. It actually should help your immune system by giving you the blueprint to say, hey, if I come across this virus, body knows what to do. It will coat the virus, it will inactivate the virus, it will cause it to not spread in the body. So that's a good thing. And then also, sometimes patients will say mess with when they're talking about, say, side effects. And I think this was already mentioned, but a lot of the known side effects from the studies are very, very well managed. They're short-lived. They can be treated with conservative measures like rest, Tylenol, things of that nature. And it usually doesn't last beyond a couple of days. So again, there's very low risk for something bad happening, and it certainly will not mess with your immunity.
Thank you. Anybody else want to take a crack? Or I think
you did a lovely job.
I think he answered that one.
I want to just take a second to talk about side effects. I think people think that side effects mean everybody's going to have an effect. Can we talk just a second about that? And I think maybe I get confused when they say side effects, or is it a body effect? Do we want to talk about that?
Right. So a side effect and reactions are one thing versus a side effect, right? So some of the normal reactions that we may have for the vaccine is people can get sore at the site. They can get a fever. They can get a headache. They can get chills. Some people may get nausea, vomiting. And normally it goes away within 24 to 48 hours. And after the first vaccine, most people don't have anything. The second vaccine is where 50% of the people begin to see some of the side effects. But that's because the virus is doing what it's supposed to do. It's recognized, why are you here? And so therefore, even though it's not the virus, right, it's that snapshot. And so it's beginning to mount up just to ensure that it is really girded up for when you were to possibly be exposed to something long term. The other thing I tell people is that some of the issues is people get insomnia, because they've stressed themselves out so much before the vaccine that they can't sleep because, they're like laying in bed at night. Is something going to happen? Or you move this way, that. But that's real for people. And so for that 24 to 48 hours, it is really stressful because then when it's done, people are like, whew, okay. But those are the things that impact people. And then what happens is because they've been so anxious that night or day or two, when they get to work the next day, they're tired, they're a little foggy, haven't really eaten much. And it's not necessarily the vaccine per se, but it is really all of the things that have led up to you actually going into getting the vaccine.
Bills stress me out and keep me up in the middle of the night. I'm counting dollars before the check even hit my account. So I don't know stressing me out any further. So, when you're thinking about taking care of your healthcare, leave that worry to your professional healthcare providers, so that that's one less thing that you have to worry about. Thank you so much. We have a couple more questions, and some of the questions that we have really are not related to medical services, but there are some good ones that we have that are related to medical services. And so I'm going to hit the medical services first, because the other ones that we're asking is really about what we think as a whole for public health. And so the first one I want to ask is, do you need to quarantine after the second shot? And should you stay more protective during the first shot?
I'll attempt to answer this question. You don't necessarily have to. We say quarantine. That was a word that just all of a sudden took off with COVID. When we say that, the original meaning behind quarantine is keeping yourself isolated so you don't spread disease. So these vaccines do not contain live virus. You are not contagious. You can't spread anything from getting these vaccines. So no, there's no need to quarantine after receiving your second shot, your first shot. Now, the caveat to that is, if you went and got your second shot and went out to a party and was exposed to COVID, could you then spread COVID? You are not fully vaccinated until 2 weeks after. So you can still have particles in your nasal or in your nose, in your mouth, and you can then still spread it if you have done something where you have been around or put yourself in a situation that you could possibly have COVID. So that is a case-by-case scenario, but it's not that you have now gotten this vaccine, you need to quarantine because you have live virus in your body and you can spread COVID. No, that is not how these vaccines work at all. But just be cognizant of your behavior, who you're around, and respect other people. So if you went and got your shot and went and had a shot party after with a bunch of people, and you could possibly be infected with COVID, respect your coworkers and anyone else until you're fully vaccinated. And you can still get COVID screened after you had the vaccine. You can still get a test and see if you're possibly infected.
So what if somebody sends me back and say, you asked the question, have you been vaccinated? Oh yeah, I've been vaccinated. Oh, well, you don't need a COVID test. How do they?
And you said, well,
people were sending people away when they said, oh, if you had a recent COVID test within the past 2 weeks, you don't need to get another COVID test. Wait another month. There's been a lot of scenarios where people have come and said, oh, well, I was turned away because they said I've already gotten a COVID test to wait some time. So
I'm sorry. I'm sorry. This is news to me.
And this is the everyday question that I get at 11:25 at night because someone was turned away from COVID testing. So I want to make sure that we encourage people, if your doctor says to do something, you find a location
Absolutely.
to
Absolutely. People should not be turned away, because ultimately people know their bodies better than we do, right? And so therefore, if I'm having symptoms that I know are not normal for me, or I've been around somebody who has been known, whether it's 2 weeks, whether it's 4 weeks, COVID doesn't care. It doesn't follow those kind of rules all the time. And so therefore, in this ballpark, you have to be able to initiate, and that's the importance of advocating for yourself, right? So the good thing is that they reached out to you afterwards the next day and say, you know what? I just found out I was exposed to somebody else, and now I've had a fever for 2 days. Why? Don't wait a month for that. You definitely want to go ahead and seek attention for that.
Mm-hmm.
Thank you. So another question that we got: does smoking defeat the purpose of wearing a mask? And because smoking affects your lungs and respiratory system.
I'll take a crack again.
Okay, go ahead. Because I'll tell you what I was thinking. Go ahead.
I'll wade in these waters for a minute. So smoking in of itself, I mean, it is a behavior that certainly can compromise how your lungs work, in terms of how air is diffused across tissues and whatnot. But it shouldn't necessarily affect how your mask works. And then also there's the other thought of, well, how long have you been smoking? So have you developed a condition such as COPD or emphysema? Or do you have an underlying chronic lung condition like asthma? So we know those sort of things, if they're in your profile, if they're in your history, that does bump up the risk that can lead to poorer health outcomes. I still would discourage smoking anyway. There's no need. And I'd say that's another thing that primary care doctors can help you with, is tobacco cessation and hotlines and helping you to quit, because it's a tough thing to do. It's not an easy feat to do. But to your point, hopefully I'm answering the question, but smoking in and of itself shouldn't render the mask ineffective, but I still would discourage smoking in and of itself.
Right. And because let's remember, you still have to breathe in the particles. So whether you have been smoking or not, it's still a airborne virus, right? The only thing that makes it difficult is your lungs have the nicotine that is sitting on. So what happens is the body and that creates its own inflammation. So when you don't wear a mask, it increases your chances of an area that's already at risk to being even more compromised is the problem. And I think that brings up another point. So many African Americans have asthma. And so that does put people at risk. Again, asthma is an inflammation response in and of itself. People wheeze because the body is saying, I don't want this in, and it closes it down. So whether that's cold air, whether it's a virus or something that it's been exposed to. And so therefore, it is imperative for us to really be able to ensure that we wear the mask and that we wear them correctly. Remember, first of all, we wear them on our chin. Then you put them on the nose. So we still are doing that. You ever walk in the store and then half the people have that mask? It's not protected. And for those who have glass, it has to be a complete seal. It has to be a complete seal. And it's uncomfortable, right? And we're tired of wearing the mask. We're tired of it behind your ears. And now instead of one, you wear two. But that is important. But because people that are Chicago has a high risk of asthmatics, and sometimes it's undiagnosed. And so therefore, you really have to be careful with that. One of the side effects too that we did talk about is not necessarily is a reaction for people who are highly allergic and they carry an EpiPen or they've been intubated before. They definitely need to see their doctor before they get the vaccine. Does that mean that they can't get the vaccine? Absolutely not. But what happens is under that direction, sometimes we have people pre-medicate before it. Sometimes people, instead of waiting 15 minutes, they have to wait 30 minutes. There's some people I know that they've given them to them in a hospital setting because the risk of them having COVID versus their condition already was so much higher that the people opt out to get the vaccine in that setting. And so therefore, it really goes back to the same thing, getting the right information to ensure that you have taken your false or information and making sure that it's factual.
And I'm one of those people who was asthmatic, and I wasn't born with asthma. I didn't get asthma until I was 32. So there are things that you definitely want to do to make sure that the vaccine is right for you. I did have to check in with my pulmonary doctor and my allergist because, of course, I have year-round allergies. I look great, thank you very much, but I'm a mess all over with allergies and asthma and so forth. So, you know, when we're saying to make sure that you have a primary care physician, you have a specialist, these are the important reasons why you should, so that you can make sure that the vaccine is right for your body. Thank you so very much. We have some other questions, and this one I think is really a good question, but there's going to be some time in which we'll need to understand if this is going to be the case. And so if it's possible to create a vaccine, I'm sorry, I jumped to another question. Hypothetically, if we have if we have to be vaccinated every year going forward, will it be a one-shot deal from here on out?
That's a good question. I hope for two reasons that it is a one shot. I would love, as a healthcare provider, to get you in once versus twice would be much easier. I think a lot of that's going to depend on the variants. I think a lot of that is going to be how the technology holds up over this year. And a lot is also going to depend upon some of the data that we need, we're getting as we go. But the longer we wait is the longer we wait, right? And so it's going to take a minute to be able to look back, what we call retrospectively, and say, okay, this vaccine was able to conquer this piece, or not conquer. This vaccine was able to make sure and eradicate at this population. So I think it's going to take a minute, but the good news is that right now, all hands are on deck. And not just here in, the south side of Chicago, but this is in Mozambique, this is in India, this is all over the world right now. And so people are sharing that information globally to ensure that we are really being, what I always say is, I'm my brother's keeper, and getting that information out there so that when we come out with the recommendations, that they are vetted and that they are to the best of our medical knowledge. Is anything a guarantee? Absolutely not. But at the same time, what we want to ensure of is that we give everybody the best shot possible globally to ensure that we as a world protect our communities.
The only thing that's a guarantee is that the government's going to get their taxes and you're going to die at some time.
And if people are kind of put off by the two-shot thing, a lot of things people don't know, because you get vaccines when you're younger, there are still viruses that require two shots. Hepatitis A, hepatitis B, there are still things that require more than one dose to build that immunity. So I know we compared a lot to the flu and the flu vaccine. This virus having two shots to require immunity does not make the vaccine inferior. It doesn't mean anything like that. That's just what the science shows now. And hopefully we get to one shot. But even if we don't, there are still vaccines, like I mentioned, where it requires multiple doses. And that's just what the body needs to build up sufficient immunity. It doesn't make it inferior.
Carl, did you have your hand up?
I didn't, but I can share a quick comment. I think maybe it's my head is just shiny. I don't know. I think this just highlights the need for us as a community to just be cognizant of how we move throughout society in terms of where are you going? And then again, considering the vaccine, not strong arming anyone, but just considering it, because now there is a bit of a game as far as how many people can you get vaccinated versus how many more variants will come across. So there's a little bit of a race that's going on. So if we want things to be good a year or two from now, it really is going to be determined a lot by what we're doing now. But again, there's a lot of promise. And I agree with everyone that if there's a one-shot deal, logistically, that is much better and helps a lot with access for patients in a variety of different communities.
Absolutely.
So we touched upon this a little earlier, but I want to make sure we are able to answer everybody's question. And so one of the questions we have, how is it possible to create a vaccine within a year when viruses like the cold or flu have gone decades without a cure?
It sounds like a Dr. Green question.
Oh.
Okay.
The issue is you have to think about, look at the number of people. When we are talking about a flu, it's generally within our area. Vaccines are within regions, right? So we've seen a flu outbreak of here. And so you focus on that and you make a prediction. This is the time and it changes constantly, right? But the number of people that get infected and impacted has been at a smaller scale, though the virus and the flu is still detrimental, because if you're that one that dies from that, it's just like it being 100%. However, in the case of this pandemic, again, some of the virology and the science behind this, they've been watching this. You know, the Ebola virus, they realized what happened. It was taking our whole families. How could the whole family be gone, you know, within the 24 to 48 hours? Is because we realized that it was airborne. So people have been learning different styles and types of viruses for years. And so when this came up, the world was its playing field. So it wasn't like we were just trying to find, you know, the flu vaccine, that's the flu virus that we were fighting here. And so what that meant was the whole world was also involved in this study and to be able to research and get information back together. And that's what was able to speed it up. But the issue, again, it goes back to people have been doing this on a regular basis, but it was just time for us to all pull out all hands on deck right now. And it allowed us the ability to share data, knowledge, information, and it also taught us how connected we were, whether we wanted to realize that or not. You know, a lot of times we look at, because COVID didn't care what was in your bank account, it didn't care, you know, the color of your skin, it didn't care what language you spoke, it didn't cover any of that. It didn't care about any of that. And so it gave us an opportunity to take that connectivity that we have together and share information at a rapid speed. The other issue is the internet is much faster now. Beforehand, when we're going to school, we are, you know, looking up things and going to the library. This time, you can put that in that little space bar and get that information like that. And so because of the speed of the internet and the travel of information, right? And we all know you can make a study say whatever you wanted to say at some point. So therefore you have to do your due diligence to be able to peel that information out and share it with forums of people that are like-minded to ensure that the outcome is beneficial for all of us. And that's what happened in this case.
And I think it's important to mention what you spoke about earlier, that this vaccine didn't just come magically out of the air in a year. It was something that was being developed, that was developed within the last 20 to 25 years. When an invention is created, sometimes that invention is not right for that moment, that time, that illness, that whatever it was intended for. And so when the perfect time is there, it's already been invented. And now that's where we find ourselves, that it was already in the process of research and development. And we've been able to find the right time, the right illness to match it with. So it didn't just come magically out in 1 year. This is something that we've been working on over a period of 20 to 25 years, up to 12 years. And so I want you to be mindful that, again, 12 years is a long time to be developing something and to perfect it so that when it's time to go to war, oh, you know what? I had this in my refrigeration unit in my scientific room, whatever their labs. I think I can use this. Let me have it researched and developed. And quite honestly, that's what leads to being prepared for war a lot of the times. So the next question we have is it more realistic to provide the Johnson & Johnson vaccine to communities of color because it's just one vaccine?
I think if you have the opportunity to get it and it's something that you want and you have access, that you should take advantage of what you have right now with the way things are being divvied up and how kind of chaotic it can be at times. If your primary provider suggested, or you have a slot, or you were able to get through CDPH, whatever the case may be, take what you have access to. But as far as having the option of a one shot, it does really help. It is beneficial to patients that we have a mobile unit where we're trying to drive out and people that can't leave their homes, that are bedbound for different reasons, trying to get them in once, let alone twice. It is very difficult. The Johnson & Johnson is ideal for those types of people. Even at our clinic, if we see someone younger that can get back to clinic, we'll reserve, we'll give them the 2 dose and say, let's hold off this 1 dose for another patient that really struggled to get here. So when you say realistic, is it logistically better? Yes. But if all you have is that one and you decided that you want it, please don't turn it away and say, you know, I'm going to wait till Johnson & Johnson is available. We don't know when that time is coming. We can't determine who gets what vaccine, where, what clinic, and we don't want you waiting and then you get infected with COVID because you were waiting for Moderna or Pfizer. So logistically, yes, but right now we're only at 14% statewide. We need to get that number up.
Thank you. So the next question we had was, can we discuss the mRNA in Pfizer Moderna versus Johnson & Johnson's? Are there pros and cons to either?
So I know Dr. Green, yeah, I mean, I was going to pass it to you because you talked about it at the top of this.
No, I am not. So the issue is, it goes back to the technology. So there's something that we call a spike protein, and that spike protein is how we're recognized, right? So for example, when we go back to when I look at I need dinnerware, right? But instead of coming with my whole everything for my dinner, I'm bringing you a fork, right? So I know that fork is to you, right? So what happens is the messenger RNA knows that when you come, you're coming with a fork. So what it does is it's able to take a snapshot of that spike protein, but then make sure that when you come with a fork and I don't want that fork, I'm gonna lock it. I'm gonna create a key so you cannot get in here. Come with that fork all you want to. You can't get in because I've locked the door. You can't attach to anything. The only difference there, and that's Pfizer or Moderna, because it uses messenger RNA. It is not a piece of DNA, and it goes away. It's not, for example, when you take Tylenol or you take something, it stays in your system for a period of time, and then after that, it goes away. It does not stay long-term in the body. But some people have fear that they were like with Dr. Green, is this the mark of the beast? Is there's a chip in there? Are they going to watch me? And I was like, okay, you talk to Google and Alexa how many days or how many times? But this is not the mark of the beast. It is not a computer chip that is inside. But what happens is it is a snapshot picture that it goes straight to take to your body. So your body can then say, okay, I've recognized this. When it comes, I'm locking the door and it can't get in. On the flip side, Johnson & Johnson does not use a messenger RNA. The difference in the facts was a little less effective than the other one, but at the same time, it still gives you a good amount of coverage. And what happens is it goes through the nucleus, but it doesn't have so a lot of the allergies that you had to worry about before, you don't have to worry about. And it goes in at the same vehicle, the way that a flu vaccine would go in, giving you a different mechanism of a picture. And then your body says, oh, okay, I need to make a army against this. So if I see this coming, then I know that I need to break it down.
I just felt like I was in the church of Dr. Green, the medical church.
No.
I want people to understand that when we are looking at percentages, look at this vaccine as insurance. You know, when you're driving, you have to have a certain amount of car insurance. And so your hopes is that you don't get into no accident. So the hopes is that you don't get COVID, right? But if you get into an accident, you know, you have the lesser insurance where it only covers the other person. And then you have, you know, the premium insurance where you can just walk away, drop the key and say, can somebody come pick me up? Some protection, whether it's 60% or 94%, is better than no percent. So always remember, do you want a percentage of something good or do you want a percentage of nothing?
And as I said, the thing that we have to remember too is that you still have to give, your body still got to show up, right? So your body still has, we've given the vaccine, but what you eat makes a difference. The amount of rest that you get makes a difference. The amount of exercise that those are all things that we can control some about how we build our immune system. You know, the fresh fruits, the vegetables, the things that we put into our body also help us that when the vaccine comes, we've given it an environment that it can really, it's like going to the gym. Oh, okay, either I'm going to the gym and they only got some 5-pound weights. So I'm gonna have to do what I gotta do with these 5-pound weights versus, oh, I'm going to the gym. They got a Peloton in here. They have a Knowledge Center. all of this. And so it's giving the body easier chance for it to get buff and build up an army. And we can do that by simple things of the amount of fresh fruits, vegetables. And we've heard that over and over again, right? But it's now really driving home the importance of what it takes for us to be able to ensure that we have an environment in our body that's able to fight.
So I just got the choir shaking their hands, so that means I'm going to the next question. And one of the questions that I think is really important that people don't speak to as much, but I know this is a question for parents: will and should children be getting vaccinated too?
So
yeah, go ahead, Dr. Lambert.
Yeah, I'll be very brief. So, initially when you looked at the trials, they really weren't testing it on patients under the age of 16 or 18. But now I just looked in the news the other day that they are starting to do trials on kids because, there's big questions about, well, when can kids go back to school, or can they go back to college or dormitory settings? Can you travel, right? So I think we are at a point where we can start asking those questions, and they're picking patients that do not have chronic conditions. They're picking, essentially young, healthy kids initially for these phases, really just to see if we were to do those vaccines, what's the optimal dose? And then with different phases of these trials, very similar to the Pfizer and Moderna ones, you're looking at what's the adequate dose. And then comparably to the general population, is there an increase in efficacy of those vaccines? Does it decrease hospitalization? Does it decrease disease states and all these other things that we're really seeing in adults? So the hope is that it would be duplicative in kids as well as adults.
Right, and there was not a lot of kids weren't in those trials originally, because you have to realize the largest people that were being affected were adults, especially 65 and older. So there was no use putting at risk do those trials and phases right now. The biggest, and not necessarily putting them at risk, but really the efforts need to be on the older population first and then down. Now, have kids gotten it and had some complications? Yes, they have. Some severe complications that kids have gotten. We've been, in fact, saw, that several kids died across the country from it, and not necessarily knowing what other underlying diseases that they had. But the one thing that we tend not to do is put children or put pregnant women in studies. And so therefore, because of that, those are things that you really have to talk with their PCP or your primary care doctor about. But to what Dr. Lambert's point is that because for a minute, we didn't even think kids could really get it. It was so few. Then we realized, oh, wait a minute, kids aren't really getting it. And so therefore, what we've learned, we've been able to take that technology now, and we'll be able to take a set of people that we will be able to look at. I just, last week, we were talking earlier, one of my sons is in San Diego. And we got some information that the variant strand is now the main strand. And I was like, oh, strain. I was like, okay. And my son is someone who can't get the vaccine. So which means that his friends and the people that are around him have to be able to protect not just themselves, right? But he has to make sure that he's very cautious. So I'm like, dude, this is your new norm for a minute, right? But you can still be safe. You can still, go out and things, but wearing a mask has to be something that you do. The hand washing, like we realized less people got the flu this year than ever before, because we got people that got the flu vaccine, and we also were wearing a mask, and we were hand washing more than we ever were before. But I think because of the multi-system failure that does happen for those kids, that's real for them. When those parents are in the ICU and their kids are almost on a vent and not doing well, it's important for us to be able to make sure that we cover all of our bases. And again, when we do this, it won't just be kids on the South Side or just kids in Chicago. We will be looking globally how we can best protect our children, just like we have with polio, with the DPT shot that we give them, the hepatitis vaccine. Vaccines have not been a new modality for treating, disease. It's just that now we have the opportunity to laser it in a little bit more specifically to ensure that we can at least identify to make sure that we're not doing any harm.
So I got another head raises from the choir. So I think that wrapped up the question around whether children will be getting vaccinated too. I spent some time with my sister who has 3 kids, 15-month-old, a 7-year-old, and 11-year-old. And to watch to watch my sister juggle all 3 of them and not have any relief throughout the day, and then have to take care of other responsibilities. My mother is 72 and she was getting, so running back and forth. I want parents to know that there are some reliefs on the way, and you will be able to kick your kids out the house at 7 a.m. and get your little break in between. So just continue to stay updated through your state and your city's portals to find out what's going on with children and vaccinations upcoming. The next question we do have is, do you know if the vaccine is a requirement to travel, go on airplanes, college campuses? And I can take this one because I'm a traveler and I've been traveling, but when I travel, I go to war. I have my face mask on, I have my goggle shields, I have a little can of Lysol spray, I have my wipes, and I have a thermometer. And people will tell you that when I approach you, you can take my temperature, but best believe I'm going to take your temperature too. So I'm prepared, but when we're thinking about travel, you have the freedom to not get vaccinated. But moving forward, there are going to be some things that cities and states will not allow you to do because their focus is on the overall health of the public. And so as of right now, you don't have a requirement to travel for vaccination, but you do have a requirement if you travel outside the United States that you have to get a PCR or an antigen test. Okay, so the antigen test is a a rapid test, right? And then the PCR test is the one that you'll swab in your sinuses, and it's going to check for the specifics around PCR. And that they consider that one a little bit stronger and a little bit more reliable. And you have to get these tests if you are traveling within 3 days of travel. Not 4, not 5. They will turn, matter of fact, the United States don't allow you to get on your plane without it being verified through your check-in customer service rep for whatever airline you're traveling on. So don't think you're going to travel outside the country and, oh, I took a test, show a receipt and get on your plane. You can't continue your check-in process until you've had your results, your actual results verified. So currently there's no requirement towards vaccines, but you will have to have a test. Now, if you're traveling within the United States, they're not requiring that you have a test to travel from state to state. What they are saying is that you have to quarantine yourself for 3 to 5 days to make sure that you are you haven't developed any symptoms. And most medical practices will tell you to really wait 5 to 7 days and limit the people that you're coming around, and to be mindful and answer the questions correctly when you're entering facilities, which means when they ask you, have you been around people, have you traveled to states that are within a red zone, be honest and say, yes, I have, so that you are making sure that you're not putting other people's at risk because you may have wanted to go away for spring break, or there was a birthday party that you just couldn't miss. So as a current, there are no requirements to travel for vaccinations, but do understand that once vaccines have actually really kicked off across the United States and a majority of people have been vaccinated, that will be your passport to live life again. And so again, you have the free will to not get vaccinated, but if you want to have some fun, that is going to be a requirement later on down the line. That's just how the United States goes. You don't have to get vaccinated, but if you want to get into this concert, you're going to have to show some proof. So again, be mindful and think about what you're going to need to enjoy life again. Did I wrap that up? Okay.
You did a great job.
Okay. Yeah, I want to get a head shake too. We have about 2 more questions, and I think this one is really good, but it was mentioned earlier. What information made you change your mind or help you want to get the vaccine? And you did touch on it, but I again want to make sure that we are answering everybody's question.
And then you want to go because you started beforehand with that.
I'll say for me, one thing, I looked at the data, of course, I looked at the numbers. other people I respected got the vaccine. Honestly, the Moderna vaccine was developed by a female Black physician. She was at the forefront of it. And it just kind of gave me like a big hug. I was like, okay, you know what? It's like Dr. Green said, there was someone like me at the forefront of this, advocating for people like me, you know, and that was the one thing. There were a lot of, I am very data driven. I looked at the numbers. I felt like it was safe. I had to do some research, honestly, on the mRNA vaccine. That is something that wasn't as familiar to me. I read on it. I said, oh, okay, this seems very safe. But then I saw this beautiful Black woman on the news. I said, you know what? Go and get this shit. So that was the one thing that took me over. And it may sound trivial compared to all the data and everything else, but I'm like you all, you know, I want to see people that look like me reflected in the people that develop the vaccines that are going inside my body and my loved ones. It just kind of gives you a little bit of reassurance. You know, you never know what's really going on, but it did give me that one piece of reassurance that at least people that look like me helped develop this vaccine. And it's why I chose to go into the career that I go into, because rarely did people look like me.
You know, I would echo the same thought, you know, that you had. And that's why I had to do the research. Okay, wait a minute. You can make a study, say whatever you wanted to say. How many people in it? How many, you know, what, you know, the ins and outs. And I have a friend who works for a pharmaceutical company. I called him. I said, I need you to break this down another level for me, please. So we really, he broke down the virology and the biochemistry for, because I know he knows if working in a major pharmaceutical company, because he's on that end of the table making sure that I said, I need to know what's for true, you know, for sure, right? And we do things with safe, but I need to make sure that this isn't profit driven, just like everybody else. It came out really fast. People got paid for it first. Okay, so wait a minute, I'm not, you know, necessarily feeling all this. At the same time, they're really doing my due diligence and realizing that I'm no different than my patients, right? But the other caveat to that was I have several friends that are ER physicians and that are physicians that worked in the units and friends that were nurses in COVID floors. And to see people who were up in a day and then the next day couldn't breathe, you know, to talk to these families and you're the last face that they see. You know, there was I think one ER doc, the guy came in, he was young and said, you know what, I just, you know, please don't let me die. I don't have any other, you know, medical problems or anything like this, you know, whatever this is you could do, can you help me? The person died 2 days later. And so when things like that begin to happen and over, and I began to talk with a group of docs who needed that, you know, venting outlet also, right? Because physicians are still people. And so understanding that compassion and that when you've done all that you can and the all that you can wasn't good enough, that was a lot. You know, that is a lot. And to see that there was no rhyme or reason. So I realized I had to understand all of the nays and all of the yays and believe that enough ethically that when I opened up my mouth to make a recommendation that I was doing that based on the greater good. And so I think when you look and talk to these families or the people that are long haulers or people that I have now, people who had never had allergies, had COVID, but now all of a sudden they have allergies or they have sleep apnea or they have other medical problems and now they've developed other autoimmune diseases. They didn't necessarily go on the vent, but that whole thing, it's taken over their whole life. Right? That's a lot for people to have to go through. And when I began to weigh the options of both, knowing that there was nothing else that we could do that could completely protect you, and now we are having more variants that are more aggressive, it was that information and ability to say, you know what, we've got to do what we've got to do. And this has to be, again, not just about what's happening here, because anybody that gets on a plane that can travel has access. You know, I can be in a grocery store, I can be anywhere. And so knowing that just that, and think about it, just breathing was putting you at risk. Just to breathe was a risk factor. And so the fact that now we have something that Is it 100%? Nothing is 100%. But what it does is at least protects you enough so that if you do get COVID, right, then the likelihood of the death of some of the other long haulers effects has been decreased. And then you have to weigh that option to see, because unfortunately, 500,000 people or more didn't get that option.
Thank you. Carl?
Yeah, I'd say for me, it really came down to the narratives. So I was pretty quick to get the vaccine. So when it came out at Rush, about a week later, I had signed up. I was pretty comfortable with everything. But in terms of sharing it with others, it really did come down to the stories. I think as healthcare providers, one of the most privileged things that we get to do is we hear people's stories, right? And the stories over the last year, probably my co-panelists can agree that they'll break your heart, patients that have lost their business, they lost their livelihoods. So patients that I've personally cared for who've passed away, some go to church with me. So being their primary care doctor and then seeing people that pass away from something that's really devastating. And then again, the pattern of it being Black and Latinx population. So people that look like me, people that I care for and care very deeply for, seeing how that they were affected and our populations are being, ravaged, I care deeply about that. So it kind of spurred this responsibility of like, okay, let me make sure I have all of my knowledge straight. Let me make sure that I'm comfortable with what I'm doing, and then to tell people about it. So using your voice, using social media, whatever instruments or whatever opportunities that you have to use that platform to really share knowledge. Again, not to push, but really just to offer wisdom with compassion and grace. So for me, it really did come down to stories and things that I've experienced, and then patients who maybe didn't pass, but I'll do virtual visits with them, and you can see the fear in their eyes. They'll say, Dr. Lambert, I thought I was going to be dead a week ago. Patients that were, I see them once a year, if that, pretty normal, but having them, they literally were on the brink of death, and seeing how real it is made me realize that anyone can catch this. Like, no one is exempt. It is not, COVID, like Dr. Green said, it does not discriminate, right? So it made it very real. It made it very urgent for myself, and then also the people that are around me, our community. So if you care, you'll talk about it. You'll spread that knowledge and try to inform people wherever you can.
Thank you. For me, it wasn't really any data. It wasn't for even me to make sure I'm driven by making sure community is okay. And my sister lost her ex-husband last year to COVID in actually May, and it's going to come up to a year. And so I have two nieces that no longer have their father. And so the driving force for me to get this vaccine was making sure that I'm still here for them. My sister constantly says, if you're not here, we're going to have a problem. And so whatever drives you to take care of someone else, to take care of yourself, try to make sure you're thinking about that as a whole when you're making this decision, because sometimes you're not making a decision for you, and you're making a decision for the overall betterment of your family, your friends, and your community. And so that's what drove me. And thank you so very much, Carl and India and Lisa, if I can all call you by your first name, if that's okay.
Absolutely. That's the beauty about COVID. It took all the barriers down, right? So absolutely.
Sure when I'm out, I give everybody roses. If you're a doctor, this is a doctor, period. Because it's important to give the kudos to the work you put in to get where you're at right now. But I think what COVID also has done is to allow us to be a unit, to be closer, that it broke down that barrier of, well, I don't think I'm high enough to be able to speak to certain people at certain times and with certain levels. So, I really enjoyed this conversation. It was an absolute honor to actually be able to moderate with such distinguished and such passionate and giving care practitioners. So thank you so very much from the bottom of my heart, from everybody who is being able to relish in the type of care that they're receiving from all of you. We have one last question, and this is really a kind of like a opinionated question, as I was saying. It's not really specific to medical medical concerns, but it's more of a public health concern. So the question is, as it concerns the vaccines, do you think it's kind of early for the city to begin selling permits to event promoters? And should venues still be required to check people's temperatures before they let people into an event?
I think we mentioned that 14% of the population is vaccinated. And I think it's almost 50% of people that are 65 and older, and they may or may not be coming to events. I think that, and I understand that businesses have suffered, and we've suffered, because we didn't even talk about the mental health of COVID for those of people who didn't even get COVID, right? But just the mental health issues that are real, that were already there in our communities. And so I think we just have to use wisdom. I think you have to look out for the business owners, but I think as a public health safety too, we still need to ensure that the measures at all costs don't take us back to where we've come from, and we're not completely out of the woods yet. So that's not a direct answer of yes, no, because if you're a business and you're on the verge of bankruptcy, or and those are all things, those are real for you as well. But at the same time, what we don't want to do is open up so fast that we put at risk the work that we've done, considering the fact that we are still just really beginning to have the conversations more, really beginning to have the availability to our communities, because we're not telling people yay or nay. What we're telling people is, let's give you some information so that you can really make informed choices. I think earlier on, the PSAs have been phenomenal, but the opportunity that you've provided now is a little realer for people, right? It's in their community, and breaking it down in a respectful manner that addresses people's questions and concerns. And even if they, put a pause to say, well, let me see, why was I not getting the vaccine, or why am I getting the vaccine? So that conversation is really underway now, and I think we will make progress. But at the same time, as we make that progress, I think we just have to make sure that when we proceed, that they realize that this is a progress in motion, not a progress that's been completed yet.
Carl, India, it's quiet.
I think you said that beautifully. I don't have anything to add.
Yeah, me neither. I think it's just whatever the process is, it'll have to be very nuanced and careful, because you don't want to shoot yourself in the foot. So if they are getting permits, I'm hoping that there's a process in place where you can screen, or maybe even encourage concert goers or whatever the event is to maybe think about getting your vaccine, or some sort of wording before you even do these events. Because again, it still is very early, and we don't want to undo all the work that years of work that's brought us to this point.
I can say that because I do a lot of community events, and I work with a lot of partners in doing that and making sure that we get to bring as many people and touch as many people as possible, that the state and the city does have guidelines for events in the future, and they have given out permits. And the guideline is pretty simple. If you're vaccinated, you can come to the event. And if you haven't been vaccinated, you have to have a PCR test within the 3 days of the event. No longer than 72 hours within the event, because then you'll bypass the time in which you need to be prepared for the event. So those are going to be the standard rules going across, and they're working with CLEAR. The CDC is working with CLEAR for it to be a passport, so that when you do get your COVID test, CLEAR will be able to pull that, and the event promoter can scan your information, and you'll get a green or a red. If you get red, that means you will not be able to enjoy this event, and if you get a green, you will be able to come into this event. So again, sometimes you have to bite the bullet to be able to enjoy the rest of life, and enjoying the rest of life right now, sadly, normalcy will be to get the vaccination and to prove that you are not a threat to public health as a whole. And I hate to say that, because people feel like, oh, well, now you're forcing me. You can create your own events. You can create your own guidelines, but it will be illegal. So you have your options. You have the tools. So this actually brings us to the close. I want to again thank each and every one of you that joined. Thank you, India, Carl, Lisa, doctors, and my amazing nurse practitioner for being here. And we're going to pass it to Tiana, if I'm saying it correct, Tiana Harris, who is just going to say a couple of things from the University of Chicago.
No, that's Tina Laurie, actually.
Oh, I'm sorry.
It's okay.
I thought the last was the last name. I apologize.
Hi everybody.
Hello.
I've just been really inspired by vaccine. I'm not a healthcare provider. I have nothing to do with public health. I'm actually a real estate professional. And I've been managing and dealing with congregate housing throughout the city. And I'm just trying to get everyone motivated to get vaccinated. I have so much passion about this because a lot of people are refusing to get it. And I've had situations where I've set up vaccinations for congregate living and people didn't show up because they thought of all the things and all the myths that the doctors and nurse had spoke of. So I just want to say I've gotten in line. I'm vaccinated. I got my first dose. I'm getting my second dose. And tomorrow we're vaccinating probably about 40 or 50 people in Hyde Park. So I have a wait list. If anybody wants to hop on that wait list, as soon as we're done with the doses for the people who are registered, I will gladly take your name and call you immediately to come and get your shot. So just for a little humor and to honor a little like Hamilton, come and get your shot. Don't miss your shot. Come and get it. That's all I got.
Thank you so very much. I just want to give a little bit of information. If you are looking to get vaccinated and you want more information, you can go to vaccine.cookcounty.il.gov. That is excuse me. I didn't have my water, so I'm a little dry because I've been running my chops, but vaccine.cookcounty.il.gov, and you can get your information. You can register for your vaccine, and they'll keep you updated. Excuse me. And I have had no problems with this website and have gotten relatively quick information. Eric?
Man, you did great, Serette.
Thank you. They did great. Amazing. I felt like I was in church, and it was. I'm down to have more conversations like this. So let's work on some.
Thank you, Lisa, Carl, and India. It was awesome. Actually, full disclosure, I actually got vaccinated. Jessica got vaccinated.
Same, yeah.
A few weeks ago. I was gonna wait also, but then she was like, "Let's go do it." And we went and did it a couple weeks ago.
Quickly.
Yeah, and we got Pfizer. Honestly, it was. I think you make up these things in your head that they're more than what it actually is. Once you do it, you're like, nah, it's no big deal. I mean, it didn't hurt. It was like no big deal. I'm going back in a couple of weeks to get the second one. So again, I wanted to do this just not to impose any kind of views on anybody or tell them to do anything. It was more so in the stores. So many people have been saying certain things about, you know, this is a chip in your shoulder and the government's out to get you. It's more like, let's just find some professionals who can actually just give some actual information. So that's all this was about. And so hopefully if one person makes a decision, I mean, I feel like this was worth it. So thank you all again.
Given a shameless plug, Howard Brown is actually doing vaccination relays where they're vaccinating more than 10,000 community members. And we have a lot of events that are coming down the pipelines with the Chicago Department of Public Health. So please go to www.howardbrown.org and find out how you can get vaccinated over the next period of 3 to 4 months. Cool. Does anybody have a shameless plug?
Oh, we're Family Christian Health Center. We are located in Harvey, but we do events all over the city. We were just at Monument of Faith the other day where we vaccinated like 300 people there. And any of our fairly qualified health centers, if you look up and you call us, we are able to vaccinate people. And if not the vaccine, even getting some other facts. We're available not just for the vaccine, but also facts of information. And no question is a question that is a dumb question or is a silly question. It's your question. And so take the opportunity to call us, reach out, and get some informed information.
I would say my only plug is if you had questions that weren't addressed today, please follow up with your primary care provider. Sometimes there's specific situations to you in your healthcare that we wouldn't even know to address. So if you felt like there was a question you had or a concern that just didn't come up because we had limited time, please follow up with primary care. If you do not have primary care, now is the time. You see what happens in our healthcare system. It's kind of survival of the fittest out here. So you really need someone advocating for you and your well-being. And it's a great time to establish that with the federally qualified health center or with Rush if they're taking new patients. I don't know the Rush situation, but I can't speak for an FQHC that we will not turn you away regardless of insurance or whatever the case may be. So please don't let that stop you. If you've lost your job, you think you can't be seen, you can't afford medications. We have so many systems to assist you with all of those barriers. We just don't know you're there, but if you come to us, we will help you because this may not be our last pandemic. So you want to really be already in care, established with someone advocating for your needs. I'll give this quick story. My mother had COVID, was discharged from Northwestern too early. Her primary care did a virtual visit and was able to directly admit her again and said, you are too ill, you need to go back. And just off a Zoom call, sent her back and had a bed waiting for her. Had she not had that, I don't know what would have happened, because she's not in the same state as me. So just having that person in the healthcare system saying, this is not your baseline. This is not how you look. I've seen you many times. This is not normal for you. When you go to the ER, they don't know you're normal. So I'm very passionate about people having primary care and somebody really fighting for their well-being. So that's my plug. Not the vaccine, yes, but just really having that relationship.
So briefly, FQHCs are in many ways, they are the unsung heroes for a lot of primary care, and especially that's highlighted during pandemics. I trained in FQHC, I love them. I put my information in the chat. So our practice at Rush, we are accepting new patients. So if you want to inquire about that, feel free to use the link.
Okay. I think that's it for us. Thank you so much, everyone, for joining. We hope that we left no one behind with your questions. And again, if you do have any questions, please make sure you can send them to the Silver Room, and they will get it to us and we will get them answered. Or you can send it to Serette at howardbrown.org, and I will reach out to our amazing providers to make sure that we do get you an answer. Thank you so much for joining, and we look to speak with you soon.
Thanks. Good night.
Okay.